always a different story of people, like what they're dealing with. And when we kind of explain our journey and what we've been through, they're like, okay, ours doesn't sound as bad. But, you know, we still want to make sure that um, we're still very gracious, that, you know, people are want to know and want to learn. So it's really, this is all about what it is, our channel is, and just making sure that I get out that information so that you, if possible, we can help you kind of prepare for that type of surgery. Now, with this specific surgery, she did have a aneurysmal segment. It measures about 2 centimeters. I'm gonna try to put it up here and see if she can send me a picture. 2 by 2 centimeters. She has pain, so whenever she sleeps, she can't lay on it too much. And if you're like most of us, like kind of lay on our arms sometimes to sleep and rest, or if she has it in a bad angle, it hurts her. So the whole purpose of this specific surgery, obviously she could have left her fistula in there, right? But the whole purpose of removing the fistula was because it was actually causing her pain, and the lumps themselves, she didn't like the way they looked, obviously. So that was one of the reasons for or behind why she wanted to have it removed. And also just it needed to be reconstructed. So there was just, it just wasn't doing what it needed to do anymore. So we just needed to get it removed. But we did have to wait a couple of years. Like most surgeons, or probably majority of the surgeons, will not allow you to remove your fistula if you have not done at least, if you have not had at least 2 years with your kidney transplant. So I'm not sure if that's different in different places or different surgeons, but that was just what we were told. They like to have large transplant patient with at least 2, well, actually 3 years is typical. But obviously, we were able to get it out a little sooner because it was causing her pain. So, but now they did the top portion. That was done last year, but this year we're doing the bottom portion, which is what's still, it's still causing her pain, obviously, because there's still lumps there, and it just, whenever she leans on, it's very tender. So we're just trying to get that portion of it out now, so that way she could feel a lot better.